Welcome to the Lighting Your Way podcast. I'm your host, Guardian Nurses founder, Betty Long. During season 3, we'll be delving in deeper to the amazing lives and stories of nurses and other healthcare professionals from around the country. We'll also be talking with a few of my nurse advocate colleagues at Guardian Nurses. You'll get a behind-the-scenes peek at the healthcare system, as well as get advice on how to get the best care when you or a loved one is a patient. I have always said that communication is the cornerstone of healthcare. Care delivery involves countless patient handoffs between providers, units, departments, and facilities, as well as interactions with multiple administrative and care professionals of various backgrounds and levels of training. Every handoff and interaction, whether it's among caregivers or between caregiver and patient, involves an exchange of information. It is no surprise, then, that effective communication is not only critical to meeting patient needs and providing safe, high-quality, and patient-centered care, it is necessary to how healthcare delivery is managed. In this episode, we talk with my Guardian Nurses colleague, Charlotte Jaroma, a nurse advocate who shares her experience helping one of her hospitalized patients who felt that her hospital team just wasn't listening. Stay tuned. Welcome, Charlotte Jaroma. Welcome to the podcast. Thanks for joining me today.
Oh, thank you so much for having me, Betty. I appreciate being here.
Yes, I appreciate you being here as well. We have a good story to talk about and certainly to help our listeners advocate for themselves if possible. But before we get into that, I would like to hear a little bit about your journey to nursing, right? So you've been a nurse for how long?
This year marks my 20th year of being a nurse, actually.
Oh, congratulations. Is that anniversary in May during typical graduation month or?
Yes, I did graduate in May. Yep, May of 2002.
Wow, congratulations. Oh, that's great. And where did you go to school at?
Thank you. So I went to Montgomery County Community College and got my associates there. And then much later in my career, probably 10 plus years later, I went to Immaculata and I received my bachelor's through Immaculata.
Oh, great. Okay, great. So 20 years. Remind me to have a cake. We'll have a cake.
Oh, well, thank you. Any reason to have cake, I'm in.
So tell me about the journey. I want to talk, a little bit about you, and then we'll talk about your role at Guardian Nurses. But tell me a little bit about the journey. What led you to nursing? We all have a different path, but what was your path?
So I think my whole life I was destined to be in the medical field. Even as a very young child, most kids want to be like firefighters, police officers, dancers, vets. I always told my mom I was going to be a magician pediatrician. And my mom told me, my mom explained that I said I wanted to trick the kids into getting better. Well, I guess I always had a little flair for the extra, even then.
Nice. I like that.
But my juggling skills really never took off, so becoming a nurse seemed like the next obvious choice. So I would say my mom was my main influence in becoming a nurse. She was like an innate caregiver. When I was a child, she worked in a skilled nursing facility. She loved her patients. She loved her job. And then growing up, I had a little sister who was very medically complex. She had a diagnosis of what was called Rett syndrome. So that's a chromosomal disorder, and it led to a lot of medical issues. She saw lots of doctors, specialists. She had a lot of surgeries, in and out of hospitals much of her early life.
Oh. And was she older or younger than you?
She was 10 years younger. I was the oldest of 4 children.
Okay.
So
you were, a lot of time you were taking care of her?
Yeah, my mom was definitely the primary caregiver. My sister never truly advanced past infancy, mentally or physically. And as her age progressed, so did her conditions. She eventually had like feeding tubes and trach and ventilator. So needless to say, I literally grew up with the medical field around me.
Wow.
Then my first year of nursing school, my dad got sick. He was diagnosed with non-small cell cancer. He did pass from that. Wow. But my mom continued to shine in her caretaker role and was my prime example through all that. So,
Wow. Okay.
and that's why I became a nurse, because of my mom.
Wow. Okay. Great. That's wonderful. And 20 years later, here you are talking about it.
Yes,
Great.
absolutely.
And so you came to Guardian Nurses after a successful hospital career, correct?
Mhm. Yes, ma'am.
Was it
So
always? I think it was
I,
in the emergency room, right?
right, like right after nursing school, I went and started in an interventional telemetry unit. I worked in the ER as a tech, and I knew I loved the ER, but I felt like I just wanted to get my feet wet and get my bearings. So I went to an interventional telemetry unit. And from there, I moved on to an ICU where I spent a very, very brief amount of time. And then I transitioned right to the emergency department where I spent over 15 years of my career, I believe.
Why do you say you had a very brief time in ICU? What was that about?
um, I spent like a year and a half there, and
Uh-huh.
it's a different place. It's very organized and very methodical, and then ER is not. You never
It's a
know what's
little
coming through the
chaos.
door.
Right.
So I like a little chaos in my life, I guess. I thrive with the chaos.
That's interesting to hear because ER is a critical care unit, really, because you're dealing with a
Yeah.
lot at a very short time. To hear an ER nurse say that the ICU didn't quite resonate with her. That's good. All right. So 15 years in the ER, and you eventually grew into management there, and then I think you joined us after that. Correct?
Yeah, I actually was led to Guardian Nurses by the same person who pulled me from the ICU to the ER, one of our colleagues here at GN. So help me
Ah.
again with my next career step.
Oh, that's great. Okay. So let's tee up so your current role, we have a lot of nurses who work in our mobile care coordinator programs, which is where you live. And you are one of three working on a large union in Philadelphia, correct?
Yes. Yep, I'm
Yeah.
one of the three nurses.
And your role in that is what?
So we have acute and chronic nurses. The acute nurses take care of the people that we meet in the hospitals, and then they transition to our chronic program, which is more of a long-term medical management program. Where I am is I'm somewhere in the middle. I have some people that have chronic issues and some people that have acute issues as well. So I work right between both of them.
And given your your 15 years in the ER, it's interesting to me that you do you do enjoy you have the complex patients who have long-term diagnoses, right, as well as the acute patients who have acute issues like an emergency hospitalization or something, right? That's how you define it?
Yes, the people that we see on an acute basis, like that go into the hospital with an issue there, but then they transition to me. So I get to travel with them through their journey from the beginning, and then I help them manage through, which is nice to see them through.
And Charlotte, explain a little bit how you get the information, because I know that the story we're going to talk about is of a patient who was in the hospital. How do you get notified that folks are hospitalized?
So being part of the health and welfare benefits, we receive reports daily of people that go into the hospital. So we know that they're at the hospital and what hospital they're at, and then we're able to go visit them at the hospital, introduce ourselves and our services to them.
And when you get into the hospital, like what kind of things are you looking for? Right, you're walking in, you're meeting the patient typically for the first time, um, and going into the room saying, "Hi, I'm your nurse." How do you introduce the service?
So how I always explain my role is that I'm a nurse advocate who helps people through their healthcare journey, but I'm mobile. I go to them. The healthcare system can be very crazy and overwhelming. So to
Mm.
give people a better understanding of the navigating through the processes, excuse me, I'm there to help people have a better understanding of going through the healthcare process. I feel like
Okay.
I'm a support and a resource. I'm an extra set of eyes and ears that can help them along the way.
Yeah.
I like to make sure their voices are heard, questions are answered, so they can better understand what's going on with them and they can get the best health care possible.
And so you would interact. So if upon going into the room and introducing yourself, if someone is not sure or not able to explain to you why they're there. Like, I don't know, they just admitted me. You would interact then with their nurse or with their physician?
Absolutely. So I make sure that the patient is okay with me speaking to the nurse or the physician on their behalf. Often we do it together. Like, I'll ask the nurse to come into the room and then talk to the patient so that the patient is being talked to and I can understand what the plan is with them.
Right. And then based on so you've met that person, you've offered your help, they've accepted your help, and then you can continue on with them post discharge.
Right, and make sure that they have follow-up care and they have all the right resources in place.
Right. And when do you typically, like, if you were to, I don't want to say discharge, but so somebody's admitted, somebody's discharged, they're home, they're good. Is that when the decision to say to the patient, okay, you're good, I'm going to move on, but I'm always here if you need me?
So with patients, as I'm here to help them as little or as much as they need.
Okay.
I can go to hospital. I go to the hospital, obviously meet them there, but I can also go to their doctor's appointments with them and help them with the plan of care at the doctor's. And I even visit them at home to make sure that everything is situated there.
Okay.
I feel ultimately I'm here to help, and the amount of help they need is completely up to them. Like, there's times that I'll speak to people multiple times a week, and then I might not speak to that same person for a few weeks.
Okay.
And if they feel that they're all wrapped up with their medical issues, sometimes we don't speak again after that, but they'll reach out if they need help making a doctor's appointment or scheduling a test or have a billing concern. So it all depends where they are in their journey and how much support they need.
Okay. Yeah, I'm sure they have you on speed dial after a certain while.
I do make sure I put my name and number in their phone so they know they can reach out to me.
No, and the mobile care coordinator program is such a unique program in that, patients are not liable, they don't have to pay for it, right? It's a benefit of their union membership or their employment, which I'm sure on some level, particularly with the fund that you represent and work with, they might be a little skeptical when you first explain it.
Absolutely. The first question always is, how do you know I'm here? And they want to make sure that I'm not going to communicate with their employer. But I assure them that it's free and confidential and that their privacy is just as important to me as it is to them. Right. I try to be very transparent with my patients and make sure that they know exactly who I'm talking to and why I'm talking to, and that they're okay with me talking to those people.
Right. Yeah, and that's as you develop trust, the patient, I'm sure, and the story we're going to talk about, I think that's the strength of that relationship continues over time, and can lead to better outcomes. I think that's what we're all looking for: better outcomes, a better experience in the healthcare system. Because since COVID, and I've heard it from a lot of our team, the healthcare system, it was burdened during COVID, but now with the resignations, with the nursing shortage, with just a lot of external factors, the healthcare system has become so difficult to manage. It was never easy, but it's really been difficult to manage. Would you agree? What's been your experience?
Absolutely. I think that sometimes in healthcare, people end up being piece treated or treated as a diagnosis. Like, for example, someone is not a diabetic. They're Jane Doe with diabetes, a whole person that needs to be treated like a whole person. They're not just a diagnosis or a room number, but they need their treatment plan is so much more than just medical management and diagnostic studies. Obviously, an essential part of their treatment, but there's so much more to that. They need mental health attention or counseling, nutrition, physical therapies. People have families and support systems that are an important part of their lives as well. And I think being able to bring light to those things and have them addressed is really one of my favorite parts of being a nurse advocate, a guardian nurses.
Yeah, and I think certainly some of the things that you've mentioned, because people are in the hospital often, I think the average length of stay is 4 days, if that. And so you can't possibly address all of those things in 4 days, particularly in a bureaucratic healthcare system. So it's nice to have the support of a nurse advocate to kind of get you through that. So let me Let me switch over and talk a little bit about the case that you and I have reviewed. So this is a long-term patient, but not necessarily, as you said, you weren't talking with her every day. Tell us about this case where you first met the patient.
So this current case, I was working with a member who I initially met at the hospital at the end of last year. They presented on the insurance report, so I went out to them and I introduced myself and our service to both them and their spouse. This was somebody who was younger, who had had a surgery, recovering from that surgery, and was due to start treatment for a newly diagnosed issue. Mm-hmm. From there, discharged to home. I called and did some follow-ups, but we all know life gets so busy, especially with the new medical issue going on, and we never really reconnected after that. So I made a couple outreach calls, left some messages. I sent a letter and a card just to check in. But then earlier this year, the member represented on another hospital census. So at that time, my partner went out to the hospital and checked in, reminded the member of our services, and then I was calling to check back in. But again, a lot of stuff going on while in the hospital. We never really reconnected. Then a couple weeks later, one afternoon, I'd gotten a phone call from the nurse navigator at the hospital that the member was going home the next day, and the spouse had given them my phone number. And so the navigator was hoping to connect with me to see how I could help support the member and their family on an outpatient basis.
Oh, that's
I was really
great.
happy that they had remembered us and our services, left our flyer and business cards. So people do come back around.
That's great. Yeah, and what I love hearing is that the hospital nurse navigator reached out. That's great. Because I think, nurses, my experience is that nurses who are working with us in the hospital understand the need for support when folks are discharged. So it's pretty cool that she reached out to you. Okay. So what happened then?
So I called the navigator back, had to leave a message. So then I reached out to the member and had to leave a message. So I reached out to the spouse and finally connected with someone. I was explaining that I received a call from the navigator and I wanted to see how I could help. From the moment we started the phone call, you could just feel the stress and the emotion in the spouse's voice. Started to explain there was so much going on, didn't have time to speak, asked me to call back. In less than a moment, it was completely evident how overwhelmed they were. So I asked if I could just come out and meet them at the hospital the next morning, and immediately they agreed. So we connected at that point.
Okay. And what was on top of your head when you went in? Like, how am I going to help? What can I do? Because this is a patient who had not engaged initially, right? But now was facing yet another hospitalization. So what were you thinking about as you headed in?
So I feel like I always go into the hospital with an open mind. I can walk in and somebody could say, get out. Somebody could be like, oh my gosh, thank goodness you're here. And then I could have people just kind of middle of the road. So I just go in with an open mind, and I knew that I would be there to assess what they need and how I could help.
Okay.
So the next morning we went over to the hospital, and when we got there, found out that the member had been transferred to the ICU. Went in, met them, and you could almost just physically feel the emotion in the room. There was so much going on. And one of the first things they said to me is, we want to be transferred out of here. Totally listened to their story, their feelings, all their concerns. And after a couple of weeks, they were just very frustrated with things. It had been like a roller coaster, lots of peaks and valleys during the hospital stay. There was some complication, and they just felt like they weren't being really listened to and getting answers. And I believe like the last transfer to the ICU was just kind of a breaking point. They had a family member who worked for another healthcare system who had been suggesting a transfer, but it was now that they were really ready to act upon it.
Okay. And did you feel that the transfer was appropriate?
Yeah, because the member wanted another opinion, another set of eyes on the case, and it was going to bring them comfort in having that done. So what became my role was to figure out how to facilitate that.
Right. But you also have to deal with the insurance company, right? So while the family may have wanted the transfer, one of the things we have to consider is, okay, is it going to be approved? And how do I get that done? So tell me about that process.
So the member wanted to leave that hospital and wanted to leave as soon as possible. So I had to get to work. First, I reached out to the nurse navigator and the social workers who had called me the day before. I met with the nurse, met with the unit manager, worked with the NP on the unit.
The NP being
after gathering all my,
the NP
I'm sorry,
is
the nurse practitioner.
Okay.
Then I finally connected with the attending to the service to help facilitate the transfer. And everybody I connected with was very well receiving of both me and my role with the member, which was amazing and made things much easier. So how it worked was the physician at that hospital had to connect with the outside hospital for a transfer and present the case. And once that case was presented, the member could facilitate transfer to another hospital.
And when did the hospital, the outside hospital that you were transferring to, dealt with the insurance approvals?
Mm-hmm. Yes, they did. So actually, usually it's done on the sending hospital side, but in this case, it did end up being on the other side. They had it approved at the receiving hospital. So once the proper physicians were connected, the transfer was initiated. After a few hours, the member and her family were very happy that the balls were rolling in motion, the transfer was pending. The nurse navigator was just waiting for word back about acceptance and insurance approval, and was going to set up transportation. And I left, and ensuring the member that their family and them had all my information, and then I was going to call back and check on progress in a couple hours.
And then what happened?
So in less than 90 minutes after I left, I received a phone call from the nurse navigator, and she had high emotion. She said to me, "The member is gone." And her tone just sent me into momentary panic. I thought, oh, my Lanza, the transfer fell through and the member left the hospital AMA. Like, what is going on? And I said, what do you mean they're gone? And the navigator explained to me that transport from the receiving hospital had come and picked up the patient and taken her to that facility.
Wow.
And this was less than 2 hours from my departure.
Oh my God. That's like record time. That's like speedy time. Holy smokes.
Maybe I'm a little bit more of a magician than I thought and didn't even know it, because it was almost magical.
Yeah,
how fast
there
that
you
happened.
go. It's full circle. Your mom would be proud of you. Charlotte the magician. And based on the transfer, was the member's care better? I mean, did the family feel better?
I think everybody felt better. The next day, I had visited the member at the new facility, and they were so much happier. Things were improving, felt like they were finally getting answers, and their voices were being heard. Improved, and actually went home a few days later.
Great.
And the member went on to get a second opinion from the new healthcare system, and is having some follow-up appointments on the outpatient.
Great. Oh, that's great. So, and you're still engaged. So they haven't, they're returning your calls now, I hope.
Yes. Yes, we are connecting more.
Right. Because I'm thinking after not answering your calls for a year, it might be helpful, given your magician status, to keep you in the back pocket, keep you on speed dial.
Everybody, indeed. I recommend it.
Yeah. So Charlotte, when you just the story, a lot of our listeners may not realize. I mean, obviously there were extenuating circumstances that led to the family asking to transfer, but that folks can, if you're in similar situations, you can always ask. It doesn't often happen. We don't often transfer patients in between acute care facilities, but it can happen if things are meeting, kind of a log jam, or, we're not moving forward, or maybe they're not getting the care they need. So I guess one of the things is to ask, right? So you just initiated that call with the nurse navigator. Yes.
Yeah, I think we were just definitely a catalyst in getting things moving.
You had initially contacted the nurse navigator to discuss transferring the patient?
Yes. So I initially reached out to the nurse navigator, and as I knew she could work with the insurance companies, and I got the full stories from the nurses and the nurse practitioner, and of course the patient and their family to um, help facilitate things along.
And if a facility doesn't have a nurse navigator, I think that's a new term, probably in the last several years, but also known as, or could be known as, the case manager, correct?
Yes, I mean, the case manager and the social workers at the hospitals also help us do the same things
Right.
as
Okay.
far as
So,
transfer and insurance approval, home cares.
and I think that's an important point, because I think even if folks who are listening don't have a nurse advocate like Charlotte Jaroma to advocate for them and to coordinate that process, they can still have that conversation with their case manager, with a social worker at the facility, right?
Absolutely. I think it's important to know that you can ask questions. Don't be afraid to ask questions. Make sure that your needs are known and that people are seeing every part of you and not seeing you just as a diagnosis of something. You deserve to be treated as such. So to ask questions and make sure that you have your needs taken care of is really essential part of your treatment plan, because at the end of the day, you're the one dealing with all this, and you need to
Right.
make sure that you have the right things in place.
Did you feel like they had, or did the family feel like the original hospital had just kind of been dealing with them as a diagnosis? Was that part of the energy in wanting to get out?
I think that there were so many ups and downs that just they felt like there was no true answers to their questions,
Mm,
that it just got moved around and they weren't getting answers to their questions.
right.
So they needed somebody just to coordinate the whole care with everything going on.
Right. And that can be so overwhelming, particularly if you're dealing with, a hospital, and you've been there a long time and there's so many players. I have been saying that for many years, that when folks ask me what the number one problem in healthcare is, as if there was only one, I always say communication, right? Like it's communication, right? We have great testing, we have great doctors, we have great nurses, right? We have a lot of great resources, but that doesn't mean that there's communication happening among those resources, right? We're all still human, and we have great electronic medical records and all this great technology, but at the end of the day, it's about humans communicating with other humans, and sometimes the ones that are communicating to the patient aren't necessarily the best.
Absolutely. I mean,
Yeah.
the old saying is communication is key, and communication goes a long way. Even when people are waiting for a test and the test gets backed up and backed up and backed up, people not addressing it doesn't make the situation better. It just makes it actually more stressful because you don't know what you're waiting for. But if you're told, there was a problem with the machine or there was somebody that had an issue, at least
Right.
you're being communicated with and you feel like you're important enough for somebody to talk to you and not just being
Yeah.
forgotten about.
Right. In fact, I tell the story so many years ago when I was a nursing supervisor. Part of the reason, it's a story that I remember really uniquely, because it was part of why I started Guardian Nurses, is that, as a supervisor, I was always called down, for conflict. Nurses would be busy on the floor, 3 to 11, and they would call and all the time be like, well, this family wants to talk to you. Okay. What's going on? I don't know. And you would go in, and I would say, hey, I'm the nursing supervisor. What's happening? How can I help? And, well, how come my mom's not eating? Uh, how come she's not allowed to eat? Okay, let me check. Right. And I would go out to the chart and see see that, oh, mom was not ordered anything to eat or drink by mouth because she was having a study in the morning. Oh, so I would go back in and tell them, and they're like, well, why didn't anybody tell us? Yeah, that's a good point. Why didn't anybody tell you? Right. And I started to put those things together time after time, shift after shift. And I thought, what's going on in our healthcare system where we're not talking to people, right? Right. People are so busy. It's not like they're sitting in the lounge, eating bonbons, right? Nurses are on the floor. They're busy. They're taking care of patients, but we're all assuming that everybody knows what's happening. And that's a bad assumption to make.
Absolutely.
Yeah.
Communication between not only the providers and the patient, but between the providers and each other, different disciplines of healthcare, like the cardiologist to the pulmonologist, the oncologist to the gastroenterologist, and things of that nature. Everybody
Right.
needs to be on the same page to get the best care for the patient.
Right. And in this case that you were talking about, I think, the patient was in for a while in the hospital, and that can extend or exacerbate any communication issues as it is. So
I think sometimes in a situation where people do spend more time in a hospital, that someone always thinks that someone else already addressed the situation, and inevitably, no one addressed the situation.
Right. What did they say about don't assume? Don't assume. I won't say it.
Absolutely.
I won't say it. Okay. So Charlotte, I always like to ask our guests, if you could have one takeaway, for a piece of advice for our listeners, as a nurse advocate, what would it be?
My advice is to ask questions, and don't be afraid to ask questions. Make sure that your needs as the patient or your family member are known. Make sure that if there's something of concern to you, that it is being addressed.
Okay. And yeah, don't be afraid to ask. It's okay. Nobody's going to be angry, or nobody's going to give you worse care because you ask a question. Yeah, don't be afraid to ask.
Absolutely.
Okay. Well,
you're in
thank
charge
you.
Of your health care.
You are in charge of your health care. Yes, you are. And I wish more patients would feel that way and feel empowered, right? And not need nurse advocates to support their way through the healthcare system. But sadly, we are here because people need us. So I want to thank you for joining me, and I actually want to say I look forward to your next magic trick.
Oh, well, thank you. I look forward to being able to perform for you.
Thanks again, Charlotte. Take care. Talk to you soon.
Thank you, Betty. Thanks for having me. Talk to you soon.
Bye-bye.
Bye-bye.
If you have any questions that you would like us to address in a future episode, please email us at podcast@guardiannurses.com. That email again is podcast@guardiannurses.com. We would love to hear from you. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, Google, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.